Hello, everybody. This is Dr. Link from the Integrative Medicine Clinic, and you probably see that I'm actually in the Integrative Medicine store. We're just getting started with this webinar tonight. I need folks out there, since this is the first time we've done this, to click in the chat box and just let me know that you can hear me out there, okay? I gather that you can hear me out there, and I'll go ahead and get started here. Again, this is the first Integrative Medicine webinar, so I hope it goes well. This is a great forum to be able to bring topics in medicine and from integrative medicine to patients of our community, and it's something I really like to do, is to teach and improve the health of our community. Great. Okay, so tonight we're going to talk about aging well, living stronger, longer. It's really not all about living longer. It's living with more vitality and capacity and health throughout the however long we live. Okay, so it's not advancing. There we go. At the end, we'll answer some questions. The talk will probably be about 30 minutes. Not quite sure exactly how long it's going to be. And if you'll put questions in actually not the question box, but the chat box, that'll be a great place. And I'll try to answer as many as possible as we go forward. And we are going to try to record this. That is in process as we go. So we'll make that available either on our website or through emails. So let me just say a little bit about medicine in general. There's no question that modern medicine is fabulous in the things that it can do now. The emergency care of trauma, infections, the surgeries that we can do, the amazing medications that are available for all sorts of conditions, from hypertension to cancer, et cetera. It's just fabulous medicine. But the problem with conventional medicine is it's really good at acute problems and not quite as good at managing or preventing chronic problems. In America has a chronic disease crisis. 50% of Americans have one or more chronic diseases, and this really does impact our health and our quality of life as we go forward. 86% of the healthcare dollars are spent on chronic disease. And despite all of the advancements in conventional medicine, this is increasing. And many of these are reversible, are preventable, and many are in fact reversible. For example, diabetes, type 2 diabetes is a very preventable condition. And even when a person gets it, they can reverse it with the right sort of lifestyle and nutritional interventions. So nutrition is really a key to the prevention of chronic disease, nutrition and lifestyle. Okay, so this looks at lifespan and health span. So the average lifespan is about 79 years. The average health span is about 63 years. That means many people, by the time they're 63, they have one or two chronic diseases or more. Hypertension, diabetes, chronic lung disease, kidney-related diseases, cardiovascular disease. And so their quality of life is often diminished by that. And so the hope is that we can extend with terrific, well, the pillars of health that we're going to get into in a few minutes, that we can extend the health span so people can live longer and stronger during those periods, be more vital, more healthy, be able to have more capacity. And what improves health span, it's in healthy aging. That's what we're going to talk about tonight. And so this new RX for healthy aging includes eating whole foods, moving every day, good quality restorative sleep, relaxation, and to stay connected. And obviously, in this time of COVID, it's been harder to stay connected. Zoom has been one of the ways that my family and I have been able to stay connected. I have a brother that lives on an island in the Caribbean, and we've been able to connect there. And even, with my grandchildren that live across town that I haven't been able to see or spend as much time with, we've done some things over Zoom, watched a movie together, for example. A little bit about integrative medicine. Integrative medicine always depends on the pillars of health that we just talked about. And then the partnership between, I'm trying to move forgive me, the partnership between the patient and the doctor is real important as well. It's really a foundation of all good medicine. And then prevention, natural approaches when possible, and pharmaceuticals, of course, when they're really, really needed. Okay, so those are the pillars of health. And along with good pillars of health, eating real food, moving, relaxing, sleeping, and stay connected. Other important things in regards to staying healthy longer is they have good preventive screening, breast cancer screening, colon cancer screening, prostate cancer screening, cholesterol and cardiovascular management. And I'll tell you, blood pressure is really vital because cardiovascular disease is often driven by not just cholesterol, but high blood pressure. And this is something that's easy now to um, evaluate at home, to get a good blood pressure cuff, and to really know what's happening there and make sure that that's normal. If not, having the right interventions to help that. So I'm going to move into this first pillar, eating whole food. And I'm going to talk a little bit about time-restricted eating there as well. So there's no question that the most important thing about nutrition, and a person can eat either high fat or low fat. The most important thing is to eat real food, is to eat real food, not the processed foods. And to emphasize vegetables, things like beans and lentils and possibly whole grains, fruits, less if you're a diabetic, and plenty of meats, fish, poultry, and eggs, interestingly. These are really healthy for us. And it turns out, and I'll go into this further as we go, it turns out that protein is really key for adults 60 and older in regards to maintaining their health, not only their musculoskeletal health and the muscle in their body, but really their immune system too. Protein is really vital as we get older. If you like dairy and you tolerate it well, whole fat dairy is better than low fat dairy. We've seen that actually low-fat dairy increases issues like diabetes, for example. Nuts are healthy, and olive oil for sure. And you might see right behind me is some of the olive oil in the integrative medicine store. And then sure, some sweets, but not too many. And then you want to avoid these foods, these highly processed foods. They have so many different things in it, but really primarily they have processed carbohydrates that are very readily absorbed into the body, driving up blood sugar and creating all sorts of havoc with our triglycerides, with diabetes, with the health of our blood vessels. So these foods are clearly not what you need very much of. So eat less of these for sure. And I think many of you know, I know that there's lots of friends at the clinic here on this webinar tonight, that fats are no longer a 4-letter word in medicine, that fats are really vital for our health. The omega-3 fats that come in that beautiful salmon there, the omega-9 fats that come in the avocado and the olive oil and the nuts, these are fabulous, and they're terrific in regards to lowering inflammation in our body, improving brain health, lowering cardiovascular disease, lowering cancer. These are really vital. And they're a great energy source for the body. So we know that dietary fat doesn't cause obesity, that it's really the processed carbs. The things I mentioned before, and in particular, the liquid carbohydrates. Those are really, really problematic to develop, excess body tissue, obesity, problems with fatty liver disease, problems with inflammation. So again, less of these processed foods. This is Dr. Walter Willett, and I'll just mention, this is a quote from him. He said that things like white bread and white rice and white pasta, potatoes and sodas make up about 30 to 40% of the calories for most Americans. And he says there's absolutely nothing good about those calories, that they lead only to harm, to weight gain, to diabetes, to coronary heart disease, and to cancer. So it's not that you never want to have those, but you really don't want to have them very often. This is an example of that. So look on the left. The left is the processed carbohydrates, the Coca-Cola, the M&Ms, even the pasta. Pasta in that bagel there, it comes from whole grain, but it's ground into a fine flour, and then it's made back into the pasta or the bagel, and then it's rapidly available for absorption in our system. And really what these wheat and grains are is they're in this form when they're grounds, it's really sugar, and you think things like orange juices would be terrific for us, but that 12 ounces of orange juice there has about 12 tablespoons of sugar in it. Not that they add it, but when you take, to make that, it takes 10 or 12 oranges to make all of that. And it's a whole lot of fruit sugar in there. And it's not healthy. Now, eating oranges are great. Now, if you look on the right, the carbohydrates that come from whole grain oats like that, or those wonderful orange lentils and the beautiful sweet potato and the kale, those are different. Those are in the whole form. They have all of the fiber there. They're slowly absorbed, and they're full with other nutrients, or packed with other important nutrients. Some of you have probably seen this slide before. So when we eat processed carbohydrates, the potatoes and the breads and things like this, the sweets, it really it spikes our blood sugar. And you can see the red line there. That's the glucose spiking and the insulin spiking. And when that happens, it turns out that then the insulin actually increases our hunger. It increases inflammation in our body, increases the risk of cancer, and certainly increases the risk of metabolic concerns like cholesterol-related issues and diabetes. So keep it simple, eat the real food, eat real food. The food that's on the outside of the grocery store, you guys have heard that, is, the processed foods in the middle of the grocery store are generally not as good for us, but these real whole foods, the foods that your great-grandparents would recognize as healthy foods, are indeed the things we should be eating today as well. And then one of the worst things we can do is we can take in liquid calories during the day. So a person could have, 8 ounces of orange juice in the morning, a mocha on the way to work, cola with lunch, maybe a drink after work, maybe a sweet tea at dinner and a beer, watching the ball game at night. And that's about 1,400 calories of liquid sugar. And liquid calories are the most rapidly absorbed into our bloodstream, spiking our blood sugars, causing problems with triglycerides, liver, diabetes, all sorts of things that aren't good for us. And I'm going to go into protein and muscle and why that's so important for us. But it's just good to avoid as I go back thinking about the last slide, it's good to avoid the liquid sugars. But these days, there's all sorts of wonderful drinks out here. Tonight, I have with me, this is a carbonated beverage that has just a few calories in it. And it's delicious and interesting to taste. It's fizzy. So on this slide, we're going to talk about just muscle and what it means for health as we go forward. So as we get older, people get frail and they lose the muscles in their hips and their shoulders. So they're less functional. They can't it's hard to get up and out of a chair necessarily. And you can see the picture of this is a cross section of a thigh right up here. And in a young person, and that is, full of muscle. But on the right is the cross section of an older person, 63, that's not been taking as good care of themselves, not as active, and they have much less muscle mass. And when we lose muscle mass through life, we lose capacity not only to move and to care for ourselves, but muscle, when you lose it, also increases the risk of diabetes. Muscle helps the metabolism of the body, and when we lose that, it changes our metabolic health in our body as well. So it's important when we eat that for adults, particularly 60 and older, that they get 30 grams of protein with 2 or 3 meals daily. And that's a challenge. 30 grams of protein is about 4 ounces of meat, like hamburger on the left, the salmon on the top. It's 4 or 5 eggs, gives you 30 grams of protein. And you really need about 30 grams with 2 or 3 meals a day to maintain the muscle as you get older. You also need some exercise like the fellas doing there on the right, but the protein's really important. Now you can get it from great sources. You can get it from yogurt, you can get it from beans, you can get it from nuts, but you need to get enough. It's very important. And again, it's not only to maintain our muscle mass, but it's to maintain our immune system. The immunoglobulins and the cells, our immune cells that help fight off infections like COVID and other infections, they are made of, and they're dependent on the protein we eat, because they're made of amino acids that come from that protein, and we really need those to maintain that part of our bodies as well, the immune system. Let me talk a little bit about when to eat. Somebody simplified it recently saying it's better to eat when the sun is out. Generally, we want to not eat from the time we get up to the time we go to bed. It's very important, very helpful to fast 2 or 3 or 4 hours before bed. It does a whole lot of things that helps with repair. Other important reasons to eat during the daytime is our digestion is optimal. People that eat midday and early in the evening tend to have less problems with reflux. They have less problems with bloating. The insulin in our body tends to work better in the middle of the day. When we eat the foods at noon and at dinner time, when we're active, we tend to use that energy rather than store that energy. And many of us make better food choices during the day than we do at night. At night, our digestion wanes. The likelihood that we're going to take calories in and then store them as fatty tissue is higher. And often it's more likely that we're going to make food choices that aren't as nutrient dense, something like ice cream or chips or a beer after dinner or something like that. So again, it's best to have most of your nutrition during about a 12, maybe 8 to 12 hour period during the day. So along with this is something a little bit more extended than that. This is the time restricted eating, where you might have 13, 14, or 15 hours of fasting overnight. You might have your first meal at 8 in the morning, or maybe 9 or 10 in the morning, and then your last meal at about 7 at night. And the reason this is important is that we know that when we take in food during the day, we fuel our body and we give our body the raw materials it needs to make the immune system and the muscles and the neurotransmitters for our brain and all of those sorts of things. And when we fast overnight is when the body can then take its attention away from digestion and its attention to repair. That's why this idea of an extended fast through the night, something like 13 or 14 hours, and it has multiple benefits. And the benefits include improving our metabolism, lowering cholesterol, lowering blood sugar, helping increase fat burning in the body, improving a condition called fatty liver disease that's really common these days, lowering inflammation in the body. And it leads to something called nutritional ketosis, which is really the process of utilizing our own body fat for energy, which is a good thing to do for lots of reasons. And if you're doing this time restricted eating in the morning, so the fasting period, you may not eat until 9 or 10 or 11 or whatever you might do, it is okay to be drinking water, tea, black coffee, those kind of things. You don't need to be dehydrated, and you can drink all of these things. It's just really not taking in calories. And in studies that look at time restricted eating, if you do this 5 or so days a week, you get all of these benefits. So you don't have to do it every day. So again, eat more of these healthy foods, eat less of these processed foods for so many reasons. Now let's talk about movement, because this is a second and a very important pillar of health for structural health, for brain health, for cardiovascular health. And really the foundation of movement is our walking. And I like to say 7,000 steps for most people most days. Now, some people, because of arthritis or other disabilities, they may not be able to get that many steps in. And even people that are quite healthy and don't have disabilities can have a challenge getting 7,000 steps in because they have a sedentary job. But just aim for that and try to do that most days. Maybe on the weekend, when you're not working, you can get 8,000, 9,000, 10,000, or maybe even more than that. But that foundational movement, aiming towards 7,000 steps and certainly 4,000 or more is really important. The next thing is to get your heart rate up, and that's called cardio. And we'll talk a little bit more about that in a minute. And then resistance training, we'll talk a lot more about that in a minute. So we know that exercise does all sorts of things for us. Improves our metabolism, so therefore it lowers the risk for diabetes, improves our immune system, lowers our risk for cancer. It improves heart disease, depression, and there's really good data now that people that are fit in midlife are much less likely to have Alzheimer's disease as they grow older. Okay, so aerobic training. So this is, getting your heart rate. People call it cardio, and it can be all sorts of different things. And you can see on this wonderful picture here that you could be riding a bike, you could be doing Zumba, you could be swimming in the pool, you could be going for a brisk walk. Love that. And if you could do that for 15 to 30 minutes, 2 or 3 days a week, that's really sufficient. You can do more if you like, but that'll do a lot for you. And now along the lines of aerobic training, there's something called interval training. And so if you, for example, if you were going to get on an exercise bike trainer, if you get in the bike and you warm your body up for about 5 minutes, and then you go really hard, so a brisk 30 seconds or so, and then you rest for 30 seconds or so, and then you go hard with increased intensity and speed for 30 seconds, those are intervals. And if you do, oh gosh, 5 or 6 or 7 intervals, that can be as good as running for 45 minutes. So good data now shows that interval training for about 15 minutes with a warm up with 5, 6, or 7 intervals and then a warm down all in about 15 minutes gives you the same cardiovascular benefit, the cardio benefit, as it does a longer run. Now, some people like to go out for a longer run and bike ride, and that's fine too. But some of us don't have quite that much time, or have some issues with their joints, and they don't want to go as long with those sorts of things. Now, a great exercise for home, we all looking for things that we can do. Many of us are at home more these days, is a rebounder. This is a trampoline. It's about 36 inches across or something like that. And this is really great for bursts of exercise. 5 minutes, 3 minutes, 6 minutes, doing this, several days a week can be amazingly good for you. It gets your heart rate up. It really moves your blood flow. It moves the lymphatic flow in our tissues, which is wonderful for us. And it's really easy on the joints because you're not doing deep knee bends. You're just bouncing up and down. I find, I have one of these at home and I find it really fun. I find it exhilarating. If you get one, I like the one with the bungee cords rather than the springs because they're not as noisy, and really enjoy it. Now more into movement. So on the side here, this is called progressive functional movement training. And I like to highlight the fun part about it. So for the lower body, these 3 exercises, on the top left is a lunge. On the top left is a squat, and 10 to 20 of those most days. And see how he only has to go down to about 90 degrees, not much lower than you would be when you're just sitting in a chair. Doing it slow with your knees out over your toes, your legs spread a little bit, balance so your knees aren't pointing in, and just do that. If you can do that 10 or 20 times a day, that maintains the power in your lower half, which is going to improve functional capacity as we get older. Now, on the bottom left is a lunge, and this also takes quite a bit of power, and it takes balance too. So in the beginning, it's certainly okay to use a balancing prop like he has there, the chair. Now in the second column there is a bridge. And this really is good for the core and the middle part of the body, the glutes. And this is a terrific exercise. 10 to 20 of these many days can be very good. And the last one is a push-up. And this is a modified push-up on the knees. Now, somebody that is real strong could do this, or maybe a real push-up, and someone that hasn't had much experience with doing push-ups lately can actually use a solid counter maybe in their kitchen. So they'll be on a diagonal, and they won't have to carry so much weight. But these sorts of movements for the upper body are, that sort of movement for the upper body is particularly helpful. I also like exercise bands. I find these very, very useful and inexpensive. And here you want to use, you want to do cardinal movements, kind of up and down with the shoulders. You can see in the top right, the person has the bands under their feet and they're pushing up over their head. Down on the bottom left is more of a curl, and you could be doing this with both arms or with just one arm. So you're pulling up, and there's another one where you're pulling down, and you could put the band over a door, or you could have a strong, solid hook on the wall that you could pull down. So exercise bands are they're convenient, they're inexpensive, and they're very effective tools for maintaining the structure of the upper body, the shoulder girdle. So a little bit more about strength training. So what we know is that muscle is the key for everyday function, metabolism, heart, and brain health. People that do resistance exercises tend to have better brain health as they go forward. Strength training works for both women and men, and there's great studies now that it works for people in their 70s and 80s. So throughout life, you can absolutely build capacity, strength, and muscle, and there's real benefits to that. 3 days a week is optimal, with one of those being a lighter training, but it's also been shown that if you do it just weekly, you're going to have benefits. So weekly would be sufficient, though it's optimal to do it 2 to 3 days weekly. You can imagine if you committed to doing some resistance training once a week for the next year, you're going to have 52 sessions in, and you will definitely see a difference in, lifting boxes, getting something out of your car, opening up heavy doors, going in and out of places. The key is to start slow to avoid injury and to progress slowly when you're prepared. So don't overdo it. Start slow and progress as possible. Typically 6 to 12 repetitions. So if you're going to do a curl like you see over on the left, you would do 6 to 12 of those in about 3 sets. That would be optimal. We know that one set is also helpful. So you just do the best you can there. You want to do it slowly with good form. And these days, what we are learning about muscle training is that we want to emphasize something called the eccentric portion of movement. So the concentric movement is when you would take the dumbbell up towards your shoulder. That's called concentric. And it's eccentric when you move the weight down. And so many of us, as I trained in my younger life, I was thinking about how much I could get up in those kind of situations as a way to knowing that I built muscle. But now we know it's the eccentric, the very slow going down, makes the most difference in actually building muscle. And so if you're going to do a curl, for example, you would pull it up on the count of 2, and then you go down on the count of 4. 1, 2, 3, 4. And you continue to do that as long as you can maintain your posture. You're not rocking back and forth. You're solid in your core, your chin is down, and you're just very controlled. And when you start losing form is when you stop and you rest until you do your next set. Okay. And then of course, if you're going to do this training, the protein that we eat really facilitates helping the muscles repair and to grow and to improve in their function. Other exercises, some of you probably do things like this, yoga or Tai Chi. We know is for all of us, whether we're young or old, balance challenging exercises are real important. And you can see here is you want to narrow your base of support. And people that have this, they have better core strength. They're much less likely to fall, break bones, things like this. Great exercise, fun too. Yoga is a similar type of exercise where you challenge balance and you stretch and balance your body. So both of those are wonderful as well. Okay, so let's move on to sleep. Sleep is amazing. It helps us get restored for the next day. It helps us during that time. We secrete hormones like growth hormone that helps repair our body. It's where we actually consolidate and store memory. And it's also really important for immune enhancement. We know now that people that have 2 or 3 nights of sleep where they're not, nights of sleep during the week where they're not sleeping well will have a decrease in their immune function and an increased susceptibility to all sorts of infections. We know that alcohol, that late night eating, that light at night, and that interruptions from pets and things like this clearly make a difference, and you want to try to avoid and limit those. We also know that if you're having sleep and you're often unrefreshed in the morning, or if your partner tells you that you're snoring, that you need to be thinking about sleep apnea. That's much more common than we ever knew, and that can affect many things from not only your fatigue and how we feel in the morning, but also things like hypertension, heart disease, atrial fibrillation, all sorts of things like that. Sleep is really vital, and many of us underplayed this in our life, at least at some point. So I recommend that if you're not getting 7 to 8 hours sleep, that you really think about investing in that time, because that's when you invest in the repair of your body and your brain for the coming day and the coming years. I also like these days, I love sleep trackers, the Apple Watch, Fitbit. There's something called the Oura Ring that can be very helpful at letting you know the quality of your sleep. And it also kind of gives you some feedback. If you eat late and then you look at your sleep pattern through the night and it wasn't as long, or it wasn't as the quality of sleep wasn't as well, you were up and down, as may have been, you may have in your own mind that you were that way, or your Fitbit or your Oura Ring told you that. You can then use that information to change what you do so that you have more nights of higher quality sleep. Another pillar of health is relaxation. When we're stressed, and many of us are too stressed too often, things like adrenaline goes up, our heart rate goes up, our breath goes up, our cortisol, which is a stress hormone, goes up. This affects memory. It has certainly negative impact on us. And so doing things to help you relax, and there's all sorts of things like the exercise and the yoga is helpful. Meditation and breathing techniques are helpful. Prayer can be helpful. Spending time with a loved one can be helpful. Taking time to relax and not always having the pedal to the metal, because you're gonna we need we can just wear ourselves out if we don't recognize that this is an important pillar of health too. There's a couple great books I like here. I love this one by Emily Fletcher called Stress Less, Accomplish More. This is a woman that went into studying a whole lot about the stress response and meditation, but it was only after she was a Fortune 500 executive and was in that sort of rat race that she realized that she needed to take better care of herself, and now she's an educator in this area. And there's also a wonderful book by James Nestor on breathing. Very interesting. Goes into very many breathing techniques, the history behind it, some of the things that you can do in your own life. It's very, very interesting. Let's talk about some important supplements. So I put vitamin D at the top because vitamin D is so important for obviously bone health, but for immune health. We know right now, and I hope that everybody that's listening that can take vitamin D is taking vitamin D right now, because it is the #1 supplement that reduces our risk of a serious COVID infection. There was several studies, I mean, dozens of studies in the last 12 months on this. And a very important study from the University of Chicago recently showed that people that were admitted to the hospital with COVID, when they were given high dose vitamin D, they had about a 45% chance, a lower chance of ending up in the ICU and dying from COVID. Vitamin D is powerful, and it's something that we all should be taking. Vitamin B12 is also very important. This is a vitamin that is crucial for blood cell generation, but also for nerve cell support and health. And when B12 gets low, people have trouble not only with anemias, but they have trouble with neuropathies and memory. And many adults over 50 are low. The absorption of B12 is a little bit more complicated in the gastrointestinal tract as compared to other vitamins, and that's the most common vitamin over age 50 to be low on. Now, omega-3s are also, I think they're a fundamental vitamin. There's really good data that omega-3s help in cardiovascular disease, lowering the risk of that. In children, it helps in brain health and reading and in cognitive ability. And in adults, it decreases the risk of Alzheimer's disease. So I find it lowers inflammation. So I think omega-3s are really, really important. Multivitamins, you could add that if you like. There's many different things in there, other B vitamins, zinc, other minerals like magnesium, calcium. So you could consider that certainly the top 3. And if you're interested, many of you may have had this test, or is that the nutritional test that we do at the clinic called the NutriVal, which looks at the 30 important essential vitamins, minerals, amino acids, fatty acids, and you can get an idea of exactly what you need. This person on the red column here was very low in B vitamins and zinc. Now, some other supplements that can be helpful. Vitamin K2 is a traffic cop for calcium in the body. And what it does is it selectively sends calcium to the bones and away from the arteries, exactly what we need. So for people that are at risk of osteoporosis or at risk of heart disease, I like this. Calcium low dose, not high dose anymore, 200 milligrams twice daily, can be used for bone health for people that have bone health issues, but most healthy adult men and women don't have to take calcium. But if there's bone health issues that are developing, then calcium is important. Many people are on statin medications to lower cholesterol. If you are, CoQ10 is often low, and that can be supplemented. Magnesium is an important mineral that helps with so many things, from restless legs to anxiety to sleep to constipation. So that's something that we often recommend. Probiotics are good for the immune system and the GI tract. And the last two, and I'll refer you to a book at the end about these. There's the last two. The first one is NMN, and this is a supplement that's been developed that helps improve cellular energy and aging. Interesting new research about it. I think it's worth taking a look at if you're interested in that. And there's one called resveratrol, and many of you know that because it comes from red wine, though you can't get nearly enough from red wine because you'd have to drink gallons of it to get enough. And this also helps with aging and cellular repair. There's a terrific book called Lifespan that I'll mention at the end that is from David Sinclair. And David Sinclair is a researcher at Harvard that has done the research in this area, and it's quite remarkable, actually. Oh, here are the books. So this book here, The New Rules of Aging Well by Dr. Frank Lipman is terrific. Frank is an integrative and functional medicine physician in New York, very, very well respected. This is a quick read, but has lots of good information in it in regards to living healthy longer. And this book, Lifespan, Why We Age and Why We Don't Have to by David Sinclair. Wow, that's a pretty striking note, why we don't have to. But so it's a very interesting book as well. He's a very well-respected researcher from Harvard in this, David Sinclair. And I mean, he was, when he discovered resveratrol, he was in the news many, many years ago and on 60 Minutes. Just an interesting guy. So to sum up, I think the new diagnosis, the new prescription for good health, living stronger longer, is to eat whole food, to move, and really kind of know some of the specifics about moving, about getting your heart rate up, having bursts of exercise, using some resistance training, because what it does to our metabolism and our health as we go forward, to make sure we're sleeping, and make sure that we're getting the impediments out of our bedroom and out of our habits that impair our sleep. To recognize that going hard in our life is important to achieve the things we want to do and take care of our family and enjoy things, but also taking time to relax is important. And then staying connected is really a key as well. And the pillars of health, as I mentioned on the left, and then the preventive screening, eating more foods like these, less like these. And then I'm just going to mention that I love to teach in our community, giving back and improving the health of the Jefferson City and Jefferson City area community is really important to me. Talks on aging well like this. I have one that I'm going to actually give as a webinar here on preventing Alzheimer's disease. Terrific new information out of the Weill Cornell Medical Center just a few months ago on how 4 out of 10 cases of Alzheimer's disease can now be prevented with they call a multimodal approach that is really looking at the personal characteristics and risks for each individual, that you can lower the risk of Alzheimer's disease. Later we'll talk about improving bone health, GI health simplified, and reducing heart disease. All of those are separate talks, and I'm willing to do this for larger groups and organizations as well. And then time for questions. And I'm going to.
So the books we're hard to see, the first set of books, can you go back to those and tell the titles of those?
Yes, I'll go back to that. Somebody asked me to go back to the books, and I'll do that. I think.
The first 2 books.
The Aging Well and the Lifespan. Oh, the Stress Less books.
Yes.
Okay. So I can't go all the way back there without changing the screen totally. So the first book is by Emily Fletcher. It's called Stress Less, Accomplish More. And the second one was by James Nestor, Nestor. and it's called Breath. And both are terrific recent books on things that are related to relaxation and stress management.
How about pearl oil versus omega-3s? What's the difference?
So someone asked about krill oil versus omega-3. So both of them are marine oils, and they do have omega oils in them. Most of the data in medicine is really done on standard omega-3 oils, not on krill oil. So I don't generally recommend krill oil because it doesn't have the scientific studies behind it to show that it can improve brain health, to show that it can reduce cardiovascular disease, to show that it can reduce inflammation. There are some reasons to consider krill oil. But I think in general, the standard omega-3s are the way to go there.
Some nights I have trouble falling asleep. Is there anything I can do to help myself fall asleep? Do you recommend melatonin?
So this question, and you may hear to the side of me is Stephanie Link, who works in the clinic and is helping me out tonight, and reading from our chat box questions. This was on falling asleep and is melatonin helpful? So a couple of things about falling asleep is, so start to make your environment darker in the evening. Try to get away from the media, particularly the screens and the TV if possible. Maybe read the last hour or so. Melatonin can be helpful for sleep onset. I like it. Sometimes something like 30 minutes before. I like things like warm baths. You know, it's interesting that when your body gets warmed up and then cools down, it's more likely to fall into sleep. I like magnesium too. That can be very safe and helpful for sleep. Yeah, that's a complex, you know, there's a lot of things else I would need to know to help you with that, but those are the kind of things I would think about.
Is diet soda bad?
The question is diet soda bad? And I would say it's not the greatest food in the world, but it's probably better than a calorie-laden drink. You know, if you have a diet soda, it doesn't have any calories in it. It's a whole lot better, I think, than drinking a Coke that's going to have 150 calories and, you know, the equivalent of 10 tablespoons of sugar in it. So there's some discussion about how the non-caloric sweeteners change your brain a little bit and actually increase your hunger for other foods. So I don't think they're the greatest, but I think for many people, when they're trying to, if they're trying to lower their calories, improve their metabolism, maybe lose a little bit of weight, I think having an occasional diet soda is okay.
Will the presentation be posted on the website? I would say yes and check in all 2 ways.
Yeah, we're hoping. Yeah, the question was, will it be posted on the website? And we hope that it will be. We believe that it's being recorded. Again, this is our first go around with it. So, but I think so, and we'll also send it out in an email as well.
Hot flashes. Tried several things. Can't take estrogen. Thoughts on black cohosh?
So the question is hot flashes and whether, in a person that can't use estrogen. Estrogen can be used safely for some women with menopausal symptoms for sure. We need to talk about that very carefully, but it can be. And there are other things that can help if you can't use hormones. Let me think. Some of the most important things, it turns out, is that a lower carb, nutrient dense diet with lots of healthy fats, omega-3s are helpful. Doing things, you know, black cohosh can help with some of the symptoms of menopause, but it's really not that great for hot flashes. For some women it works, but I haven't seen it work fabulously well. There is a Siberian rhubarb that is available as a nutraceutical that we use for hot flashes. And then there's some medications that can be used too. There are non-estrogens if needed. Meditation, acupuncture, all of those things can be helpful. But I think it you know, if a person's life is balanced, they're getting good sleep, good nutrition, good exercise, they're doing relaxation, often the hot flashes will be less. They may not go away totally, but they should improve. And then other things can be added if needed.
So the question is, are nuts from Aldi's healthy? And I think it would depend on what we're.
Are nuts from Aldi's healthy? You know, I think there's a lot of great healthy foods at Aldi's, and it's less expensive for many people, and I think it's probably a terrific place. And you just need to read the label. So a lot of those nuts that come in cans, and if they're processed in other oils, they're not as healthy. But if you get the fresh nuts from the produce section, the almonds and the pistachios and walnuts, those are terrific. And nuts are just fabulous for us in regards to so many things, lowering the risk of cancer and heart disease and brain health. And we've all been concerned that nuts, because they're high in fat, cause increased weight gain and so forth. But it turns out that nut eaters typically don't have any more or less issues necessarily in weight gain than other people. So I wouldn't worry about that part of it. Yeah, they should be healthy from Aldi's.
Drinking decaf coffee 1 or 2 cups a day.
Yeah, drinking decaf coffee. You know, that brings my mind back to the question about sleep. So I think decaf coffee is fine. It's been shown to have many of the same sort of health benefits that coffee has. You know, coffee has lots of antioxidants. You know, it can improve things. There's pretty good data about less cardiovascular disease, better brain health, less cancer, certain cancers with coffee. It's a really neat bean, the coffee bean, and has lots of wonderful polyphenols that are healthy for us. And decaf has most of those properties. It doesn't have the caffeine, but it has most of those properties. And I'll just reflect back to the question about sleep. So some of the issues with going to sleep for people is that they have caffeine in their life, and some people are slow processors of caffeine. So even if they only have 1 cup in the morning, it still keeps their brain a little vigilant even at night. So it's harder to fall asleep and to stay asleep. So if you're having trouble with sleep, either falling asleep or staying asleep, as hard as it may be for those of us who love coffee, going off caffeinated coffee for a month or two is likely to improve sleep.
If you have osteopenia and cannot eat dairy or eggs, what would you recommend for bone health?
The question was about bone health, and do we need to have dairy for bone health? And eggs. So eggs are a great source of protein, not a great source of calcium. It turns out the most important thing about strong bones is the protein we eat and the most important things in the exercise we get. That calcium really plays a much lower role. In fact, I showed you Dr. Willett's picture, and he was a researcher from Harvard, one of our most terrific, most respected nutrition scientists. He said it's a whole lot better to walk the cow than it is to drink the milk if you want to have good, healthy bones. And the reason he said that is that international studies show that the places where the highest level of dairy is eaten are consumed on our planet, like in Finland and Scandinavia, they have the highest incidence of osteoporosis. Dairy is not critical for good bones. And it's not even critical to get good amounts of calcium. You know, there's terrific amount of calcium in things like almonds, in broccoli, in sesame seeds, in plenty of other foods with calcium. So you don't have to worry about that. But again, the biggest things are really activity, healthy activities, protein, and of course vitamin D. And I like vitamin K as well, vitamin K2 for that.
So that was the next question. What about adding K2? What does that do?
So K2 is one of the K2 is a vitamin K, but it's very specific for managing where calcium goes in the body. And K2 directs calcium to the bones, and it directs it away from the arteries. So it's good for both people with heart health. You know, atherosclerosis, or hardening of the arteries, is calcium deposits in the arteries in to large extent. And so K2 helps prevent that. It lessens that, and it keeps the calcium in the bones where we want it.
Is there harm in taking omega-3, 6, and 9 versus just omega?
Is there harm in taking omega-3, 6, and 9? I don't generally recommend that, because I think you can get your omega-9 from olive oil, and I just recommend that people use olive oil, 2 to 4 tablespoons a day with their food, putting it in and on their food. So that's omega-9. And omega-6s, we get that from any grains we eat. So I don't think there's really any benefit to add additional omega-6. So really the one we want to add if you're going to take a supplement, if you're not eating fish a couple of times a week, is an omega-3 supplement. And for those of you that don't really want to take a supplement like omega-3, you know, if you eat terrific cold water fish like salmon or Chilean sea bass or sardines, those are really they're packed with omega-3s. And if you had those 2, 3, 4 times a week, you don't need to take, most people wouldn't need to take an omega-3.
Are there any recommended whole grain breads that you can eat safely in light moderation?
Yeah, whole grain breads. Yeah, I think they're, uh, I don't do a lot of shopping for bread. It's not a part of my diet. Um, but I know that they're high grade artisan breads that are made of coarsely ground wheat rather than finely ground wheat, and with limited ingredients, good yeast and the good ingredients and not a lot of other ingredients or poor quality oils, etc. So I would say read labels for that. Look for coarse ground artisan bread, something you might find at a high quality health food store. But again, I don't shop for them. You might find them at our local grocery stores too.
All right, with high blood pressure, does beet supplements help? They think beets are nasty.
Okay, so somebody asked about high blood pressure in beets. So beets are wonderful. They increase something in our body called nitric oxide, and nitric oxide is a natural vasodilator for our blood vessels. And so beets are wonderful for that. There are some beet supplements that you can take that'll give you similar effects. Yeah, and they're really yeah. I'd rather see you eat the whole food. I think beets are a terrific part of the diet. I'd love to steam mine and then just add them to different dishes throughout the week. Um, I'd love having those. I love the color of them. I love the benefits for the cardiovascular system. And actually there's benefits for, these days athletes are using beets and beet supplements before they exercise and before they compete, because it really helps for great vasodilation of their arteries so they can perform better and get more blood flow to their muscles.
Would you take a magnesium supplement daily?
Somebody asked about magnesium supplements and whether you would take it daily. Many people do take magnesium supplements daily. There are different magnesiums, but it can, people that have slow bowels and tend towards constipation can use something like a magnesium citrate daily, very safely. People that have sleep-related issues can take something like a magnesium glycinate. That's a different magnesium that is particularly good at sleep, helping with sleep and helping with things like restless leg syndrome. So magnesium can certainly be taken daily. Now, when I answer some of these questions it's probably best at some point that you connect with us and get it, answered specifically for you. But in a general way, magnesium is really, it's a very safe mineral, one that many Americans are low on. We have less magnesium in our soil and less in our plants, and we mostly get magnesium from our plants, and many of us aren't eating enough of the fruits and vegetables to get it from. And I think that's all the questions. I thank everybody for joining us tonight and taking this initial ride for a integrative medicine seminar. I hope that you all were able to take something from this that can help you live healthier and stronger and more vital as you go forward. Look forward to seeing you at future webinars and in the clinic. Take good care, everybody.